Hello, everyone. It's a great pleasure to be with all of you today, this afternoon. We are celebrating the Clean Hospitals Day, and you are in the Saraya sponsored session of the Clean Hospitals Digital Day, which is an exciting day because that's the very first time we do a Clean Hospitals Digital Day. So for us, it's a little new, and we have been from one session to another. There have been questions from all over the world coming. We need to stick to our timing. And without further ado, I would like to thank my colleagues, and I should say friends and colleagues, Pierre Parneix from France, Fernando Bellissimo-Rodriguez from Brazil, Hiroki Saito from Japan. Hello, everyone. And thanks for being with us today. Today we will have a hand hygiene session that is actually thinking about all what happened over the past, I should say, 20 months around alcohol-based hand rub. You remember alcohol-based hand rubs were the tools that we promoted for several years in hospitals, but suddenly because of COVID, and this is something we have seen earlier in the past with H1N1, alcohol-based hand rub became the tool to fight against COVID-19, not only in the hospitals, but in all communities around the world. And this is what we will review together today, discussing alcohol-based hand rub as a game changer, actually. And I think that you are the great person to address this issue. Pierre will address the issue of somewhere healthcare and community. Fernando will address the issue of the efficiency and the quality control, and Hiroki will address the issue of local production and sort of opening these to the rest of the world. So without further ado, I would like to invite you, Pierre, to start, and thank you again for being with us. Pierre Parneix.
Thanks a lot, Didier. Do you see my slides without problem?
Yes, we do.
Okay, so here we go. Thanks a lot to the Saraya company to organize this nice symposium with my colleagues and friends. So I'm working in a regional organization with national mission. We have the one to support all the activities in the field of infection control promotion. So we are mainly in French, but some stuff in English. You can look at our website. We have the mission to promote May the 5th day, so the Hand Hygiene Day, the worldwide day. And you see on this map, all the healthcare setting was been involved in using our national tools in France last May the 5th, 2021. So it's a lot of interesting guys. And as everyone, we have winners of the challenges. And you see a lot of French healthcare professionals happy to have nice hand hygiene strategy. We have also what we call toolbox with a lot of tools, methodology, and we call this one pulp friction. Pulp is a fingertip in French, to promote and evaluate and assess hand hygiene. So first, now we start to have some behavior specialists in our team. You have seen that in the first session with a US colleague. It's very important that we have started to search barrier and levers that could promote and help us to understand hand hygiene better. It has been published in the last EPIP journal issue. So we have performed 46 healthcare professionals interviews in our region and the Guadeloupe in the French West Indies. So individual interviews, a focus group, different caregivers with very simple question. How do you explain the fact that some caregivers do not always use alcohol-based product? What could motivate them to use it? What would you need in practice to improve your hand hygiene strategy? So with a sophisticated methodology of descending hierarchical analysis of the words that were used by professionals, a specialist classifies the barriers in three main groups. The first one is about the composition of the product himself and the aspect of unpleasantness and harmfulness. It's the main one, 48%. You have also something around intra-interpersonal factors. That is important because it's around the habits and the way that the habits are leading us not to do the right things. It's the less frequent. And class 2 is also very important. We have all the things linked with the lack of time, the overburden, all the organization factor, and the availability of the product. We'll say that a little later. In the class 1, we have also the cognitive biases and all the fake news that Didier spoke about a little earlier. Some verbatim issued for that. The class 1, you see, yes, we have a lot of products, but we have problem with them. And the class 1, even more, you're sending that as a best product ever, but is there not things hidden behind that? And in France, it's all these cognitive biases are very important and strong among healthcare professionals, and we need to address them. For the facilitators, three main possibilities: incitement to use these products, so it's still important to incite people and to promote the use. The main one is the collective involvement. It's not someone alone who is doing that. It's a collective action to improve hand hygiene in a ward. And at the end, but still very present, the accessibility of the product at any spaces. In France, we do not use many pocket products, so we have that in dispensers. Upper friction tools are also an auto-evaluation tools, which is very appreciated by healthcare professionals. The ICP is going to meet the people and to share a vision and to assess the diagnosis of the team, at which level the team is, asking them about the barriers of the professionals. They ask also patients, but we will not speak of that here. There's an automated report, and we have 3 stages of changes in the behavior of people, and we could discuss that with the team and try to improve things at world level. So have you seen in this data, we have performed the study, analyzed the study, first 2019 before the COVID crisis and during the COVID crisis, so the first part of the COVID crisis in France. And on the last line, you see that the share of friction reported has a little bit improved during this period of time, from 61 to 67%. If we look at the frequency of adherence to friction, you see that there's a lot of gap, even with self-reported situation. But what we can see is the last line. We are in the clean hospitals day, and you see that after touching the patient's environment at the end of the crisis, at the end of 2020, it was a huge improvement for professionals to wash their hands or clean their hands in this situation. There has been a growing awareness in that field. We also ask people not only what they do, but what they feel important to do. It's very important for the psychologist. And you see a little things similar with an improvement. Globally, the vision, the perception, and what is doing on the field has improved in healthcare settings around hand hygiene during the crisis. The barriers are very important. In 2019, first, the fear of an harmful product, very present in France, linked to fake news. The unpleasant product, all the products are not equal, it's evident. And third, the idea that some care are not at risk of infection, so we can not perform hand hygiene. So during the crisis, the things has moved a little bit. In the first trimester, we had also in France some problem of resources in handrub products. The main company has a problem to deliver them in hospitals. So, and after that, we have seen that the availability, obviously, avec the huge increase of the use, has been the main issue. But you have also the third main problem still very present in our healthcare professional representation. So what about in the French populations? This French one is a little bit arrogant, but I assume it. Public Health France has monitored during all the COVID crisis what the French population were feeling to do. So you see that mask wearing public in blue, dark blue, has risen as soon as we had mask in France. And hygiene in red was quite high and has not progressed at all. It decreased a little bit during the crisis. It is the feeling that French people are performing more hand hygiene. But on the field, what is the reality? We have performed a very short study. It's a French article, but the summary in English is enough to understand that. Very quick study, network of volunteers recruited with a colleague with an occupational doctor on LinkedIn. 3 surveys between January and April. Honestly, within 2 weeks, the first study was performed. You ask people to enter a shop to assess the alcohol-based end product mandatory installation. It was mandatory to have one and to use it, but not to control the use. And just observe the next 10 consumers to enter. So the handrub product were quite often visible, 83%, but it was only reminded by someone in 11% that if you don't do that, you need to do that. And the results are interesting. And compliance when entering a supermarket was only 40% for French people. And if someone saying, please do that, it raised to 90%. Very simple to obtain this high level of quality. So how to move forward now to improve things in the future? I think in a pulp friction project, we have some vision of that. Improve accessibility is important to have the product easy to access, visible, regularly replenished. For those who have seen the industrialization just before, you have now automatic tools that can alert you on the need to refurbish your dispensers. The quality of the products, obviously, you need maybe to propose different products for the people, not too much, but different. And the practicability of the disinfection of hands. To convince, showing and demonstrate, people like to see how bacteria could transmit or move from one to another, use color things to do that. It's important. To convince, arguing, need to fight against fake news. It's very important. Communication is a basis. We need to communicate all the time. And raising awareness among patients and visitors. It's very important. And we have a nice leaflet that people are doing. After reading that, they're more eager, patients and visitors, to have an hygiene. It's quite simple to improve things. So how to move forward? It's my supermarket. Now you see on the far right, the automatic dispenser is a very nice one. In a full heart of the crisis, it was totally at the center. It was the time of 40% what is infecting their hands. Now it's on the right there. And I can tell you that nearly the only one that is using the dispenser when I'm entering the supermarket. And maybe in some days there will be no more dispenser. And we need to fight against that. Didier has led in France a very huge mission to assess the crisis management at the demand of the French President Emmanuel Macron. And one of the 40 propositions the mission has made under his leadership is to create, under the Public Health France Agency, a permanent observatory of the practice in the general population to see what the French are doing. If you don't do that, within some months, nobody will remember barrier, jest, and everything will go back to nearly zero. So this proposal is under the way. It's not fast in France, but we have good hope to see that in the future. So my vision is things have really improved a lot during the crisis. We understand better the barriers, we know the levels. The population has made a lot of improvement, even though it was not perfect, but we need now to keep the momentum going and not to lose the benefit of the crisis, as Didier said in its introduction this morning. Thanks a lot.
Thank you very much, Pierre. Thanks a lot for this fantastic tour of the behavior that we could witness based on your results. We will take questions at the end because it may be a little easier overall. So without further ado, I will ask now Fernando to actually upgrade his presentation and start with his part of this session. And I would like to thank Saraya, again, our sponsor, for this fantastic session. Fernando, floor is yours.
Thank you, Didier. Hope you all can see my slides now. Do you can see?
Yes.
Yes, we can see
Okay.
it. Go ahead.
So good morning, good afternoon, and good evening to everyone around the globe attending this session. I'd like to thank Professor Pité and Saraya for this invitation and the opportunity to join you today discussing important issues about the efficacy of alcohol-based hand rub against COVID-19, including aspects of quality control and cost effectiveness. Not sure my slides are moving. Okay, now I have no conflicts of interest to declare. And the very first question to be answered is alcohol-based hand rub able to kill or inactivate the SARS-CoV-2 virus? Fortunately for us, SARS-CoV-2 is an enveloped virus, which means that it has an envelope around it full of fat and proteins that can be denatured by the contact with alcohol. This would be not the case if SARS-CoV-2 was a non-enveloped virus, such as norovirus or poliovirus, which are far more difficult to be killed. So basically, alcohol presents a high affinity for this envelope content. It attaches to the envelope, causing its rupture. And once alcohol is inside the virus, it can fully denature other proteins and internal structures that ultimately kill the virus. This has been demonstrated through by some studies, like this one published in the Emerging Infectious Disease, in which alcohol and WHO alcohol-based hand rub formulations were tested in vitro against virus suspensions. As you can see in these graphics, both the ethanol-based and the isopropanol-based formulations were able to fully inactivate the virus in concentration as low as 30%. Pretty much the same has been demonstrated for some commercial products. So in the study published in the American Journal of Infection Control, we observed a large log-10 reduction in virus concentrations after treating virus suspension with either a 7% ethanol gel or a 70% ethanol foam. Moving forward, another study evaluated the stability of SARS-CoV-2 on a human skin model. So they used like in human skin autopsy specimen and could demonstrate that the virus is able to survive up to 8 hours in such condition. Of course, we don't know if this could lead to such a prolonged period of transmission because we don't know what is the minimum inoculum to establish transmission. But anyway, the most important finding of this study is that in this human skin model, virus titers dropped sharply after a brief contact with 80% ethanol solution. Just after 15 seconds of contact, the concentration dropped sharply, as you see in this graphic, demonstrating again that alcohol-based hand rub is highly efficacious against SARS-CoV-2. So we all agree with that, but what about production quality control? Does it matter, or we can just produce a hand sanitizer in the house with an internet recipe? We need to be very careful with that because there are many factors that can potentially affect the virucidal effect of alcohol against SARS-CoV-2. That includes the type of alcohol employed, the volume applied, and the time of contact, the type of the formulation used, the percentage of alcohol content, and eventually the presence of dirt in the skin. Therefore, we must ensure that we are actually producing a good hand hygiene product that will not fail us in clinical practice. This was a cross-sectional study assessing the adequacy of alcohol-based hand rub production in 13 public hospitals from Ethiopia. So as you can see in the table, the percentage of compliance with essential compounding activities for the local production of alcohol-based hand rub, as recommended in WHO guidance, is variable. So you see, regarding checking the expiry dates of the raw materials, most of the hospitals complied with that, but not every hospital. Checking the strength of raw materials, the same. Calculating the quantities of each ingredient, mixing order in a proper way was accomplished for 10 hospitals, but not for 2 hospitals, and so on. In the same study, the authors also checked the compliance with a specific quality control activity in the same hospitals from Ethiopia. And as you can see in the table, compliance was suboptimal for all evaluated processes. So how ethanol was tested for its strength only in half of the hospitals evaluated. Hydrogen peroxide strength was determined in raw materials only in 1 hospital. No hospital tested the hydrogen peroxide strength after the alcohol-based hand rub solution was prepared, and so on. As you may have heard from the media, since the beginning of the COVID-19 pandemic, many plants designed to produce ethanol as a fuel were converted to produce ethanol hand sanitizers or surface disinfectants. The problem is, those plants need to undergo additional treatment to curb their impurities to limits set by the FDA for alcohol-based hand rubs and alcohol-based disinfectants. In the present study, 17 process streams in a dry mill ethanol plant in the USA were analyzed to determine the quality parameters for acetaldehyde, acetal, propanol, methanol, and water. Just summarizing the results, authors found levels of acetaldehyde and methanol at some points of the process significantly higher than the impurity limits set by the FDA. As you may already know, methanol is highly toxic for humans, and there have been some sporadic case reports of severe poisoning and sometimes leading even to death due to the ingestion of hand sanitizers contaminated with methanol. Methanol should never be present in alcohol-based hand rub because it can be absorbed through the skin, internally metabolized in formic acid, which is highly toxic for many organs and tissues, including the central nervous system. Perhaps the most tragic situation demonstrating the potential harm of methanol occurred in Iran, where over 700 people died after ingesting methanol, falsely believing it could cure or prevent COVID-19, which has been spread through fake news through social media. So, well-prepared alcohol-based hand rub is highly efficacious against SARS-CoV-2, but does this readily translate into clinical effectiveness for COVID-19 prevention? Taking into account that the virus can be transmitted by different routes, we must bear in mind that combined measures need to be taken for effective COVID-19 prevention. So when we talk about respiratory transmission route, social distance and masking, face masking are the effective measures, much more important than hand hygiene. On the other hand, when we think about the contact transmission route, there, alcohol-based hand rub plays an essential role in breaking the chain of the virus transmission. So what are other factors potentially affecting this effectiveness of hand hygiene against COVID-19 and SARS-CoV-2? So one of the most important, especially in low and middle income countries from the global south, is the availability of adequate resources for performing hand hygiene. So in the present study, healthcare facilities from 18 African countries were evaluated in this regard. And as you can see in the figure, adequate resources were found only in 3/4 of them. Obviously, there is a large room for improvement in that scenario. In the SAFE study, hand hygiene resources at the population level were evaluated. As you see in the graphic, in some countries such as Ethiopia and Malawi, the vast majority of the population lack adequate resources for performing hand hygiene in their daily life. That's why initiatives such as the one Dr. Hiroki is going to tell you about in a few minutes are very, very important. Well, one could say, is there a problem only for low and middle income countries? Absolutely not. We are all in the same boat, and no country can completely isolate itself from others. That's one of the things that the pandemic made us realize for sure. It doesn't matter if you can fully control the virus spread within your country, because if it freely spreads in other countries, that could lead to the breed of new variants that could turn back and overcome vaccination in your own country. That already happening in the UK, in Brazil, and India, where some of the most virulent variants of concern originated. Another factor potentially affecting the effectiveness of hand hygiene against SARS-CoV is what Pierre just mentioned to you, is the compliance with the procedure. So in this prospective observational study from the group of Caroline Landel in Grenoble, they assessed nosocomial transmission of SARS-CoV-2 within the facility. And one of the main factors authors identify as a contributor to transmission was suboptimal hand hygiene compliance among healthcare workers, estimated to be in 6% of the WHO indications for that. So in conclusion, hand hygiene with alcohol-based hand rub can be very effective for COVID-19 prevention, as long as it's properly produced, it's made universally available, it's promoted through multimodal campaigns, and implemented along with other important preventive measures, such as social distancing, face masking, and of course, mass vaccination campaigns. With that, I thank you very much for your attention, and we'll be glad to further discuss the topic at the end of the session.
Thank you. Thank you very much, Fernando. It was a great summary of the fact, and I'm glad you could go over this topic with us today. So as you say, we'll take questions and answers at the end of the session. And without further ado, and you nicely introduced actually the next speaker, Hiroki Saito from Japan. And I'm asking Hiroki to actually introduce his lecture about local production, as you will all understand. Thank you very much, Hiroki, for being with us.
Hello, thank you very much for your introduction. I'm Hiroki from Japan. Sorry, I I'm still working, and the positive aspect of a new era with COVID-19 is that we can attend a conference from anywhere from the world. But the negative side is that I cannot attend the, I can't stay away from my clinical duty. So I'm on night shift right now, but I have a pre-recorded video, so you can enjoy my video. Thank you.
Hello, my name is Hiroki Saito. I'm an ID physician and I see a doctor based in Japan. I'm also a PhD student at University of Geneva, supervised by Professor Didier Pité. It is my great pleasure to give a talk today. Today, I will talk about local production of alcohol-based handrub, a perfect example ready for prime time in Uganda, Africa. I have been working in Uganda for more than 10 years, and I will share some of my experiences with you today. This is my disclosure of interest. My research in Uganda is funded by Saraya. We all know about Sustainable Development Goals. SDG 3 and SDG 6 are particularly related to infection prevention control, IPC, and hand hygiene. And COVID-19 has highlighted the importance more than ever. With regard to hand hygiene relevant issues, what is the reality in developing countries? The problem is poor access to water. As you can see this global map, Sub-Saharan Africa is in red, suggesting access to soap and water remains very poor. The same applies to healthcare facilities where hygienic activities are far more important. For example, 1 in 4 facilities lack basic water, according to the WHO UNICEF report in 2020. And 1 in 3 facilities lack hand hygiene facilities at point of care. So we can easily imagine that the COVID-19 pandemic worsened the situation and broke the supply-demand balance, where the demand means the timing and moment proper hand hygiene actions or IPC measures are needed. How can we solve this problem, particularly where the resource is limited? This paper is becoming a little bit old, but reflects the global situation on local production of ABHR in the world. And as you can see here, local production of ABHR was already common in low-middle income countries several years ago. And this article reported that sugarcane had been used, and Uganda was reported to be one of the countries where ABHR was locally produced. We published a paper on a study in Uganda named Warrior Study, where we showed that local ABHR production helped improve hand hygiene in resource-limited setting. Hand hygiene compliance during the baseline was less than 10%. After intervention of ABHR production and education, particularly the pediatric wards had the highest compliance rate of 76%, while the rate of HAIs, healthcare-associated infections, decreased dramatically, as shown here in this figure. However, the limitations of this study included the fact that this study was a single-center study with a single before and after design over a relatively short duration at 6 months. Therefore, the problem or question remains how to scale up in a more sustainable way in Uganda. Now, we are conducting a new study called Mikono study in Uganda. Mikono means hand in Swahili. I will show you the video from the field.
Here we are again in Uganda this year. We are here to start the implementation of the strategy for the improvement of hand hygiene in hospitals in the east of Uganda. We have chosen to actually do it in this part of Uganda because of the diversity of hospitals and also because we knew about the region and because we wanted to actually approach different type of hospitals. A major system change is needed. When I say a major system change, I mean we need to install alcohol-based handrub dispensers wherever needed. We need also to provide the sufficient amount of alcohol-based handrub as necessary to actually make sure that healthcare workers will never miss alcohol at the point of care when needed, and we need to make sure it is sustainable over time. So this would be the major impact of the intervention. Of course, we visited the Ministry of Health. We also visited the research center and the ethical committee that reviewed the protocol. We were really warmly welcomed everywhere. So it was a great pleasure to interact and to actually partner with all those colleagues and friends. The team asked us at the Ministry of Health, could you build up this intervention for the entire country? Actually, what we want to do is first to test the feasibility, validity, and sustainability of the intervention in this part of the country before we could expand to the rest of the country. We actually visited hospitals in 4 districts, in Bale, in Kumi, in Tororo, and in Busia. Each time we selected hospitals that are either district hospitals, regional hospitals, or actually health centers. Why? Because we want to look at the feasibility and adaptability of the intervention in different size hospitals. So they are very different. There are places where, of course, there are a lot more procedures performed and a lot more healthcare workers to train than others. But really we wanted to see and have a perception of the difference that we could find in those different places. These hospitals, of course, will be model hospital in the future. Now remember that to promote the change in the behavior of the healthcare workers toward a better hand hygiene performance, you need essentially 2 elements. The first element, the alcohol-based handrub, must be available at the point of care. And the second element is, of course, the implementation of the education and the change in the behavior that will actually promote a better attitude. to ensure the system change would not tolerate system failure. System failure would mean that alcohol would suddenly not be available at the point of care. When we asked them the question, is alcohol handrub available in your institution? They all said, yes, it is, but unfortunately, we don't have enough. What we want is every single healthcare workers to benefit from the capacity to access at the point of care alcohol-based handrub. It would be impossible to ensure universal system change without producing the alcohol locally. You could produce alcohol-based handrub locally out of sugarcane. We visited again the Saraya company that actually is producing alcohol-based handrub out of sugarcane byproducts in Jinja in the middle of Uganda. It's always a great pleasure to visit the Kakira sugar factory. It's a unique factory as far as I know, because first of all, it's a very huge complex. The Kakira owners have decided not to include too much mechanics. Why? Because you want to save the jobs first. Almost 10,000 employees working in the factories and their families living with them, which means almost 45,000 people living in a large community in 22 different villages all around the places. It's really something unique that you can see. It's a real social business venture. We have been working on producing the alcohol, making sure it would be available. Now we are into the human factor that we are ready to implement it all over the place in this eastern part of Africa. This is an absolutely great advance for healthcare in Africa and of course for the people of Uganda.
Just to summarize the Mikono project again, it is now longer, over 3.5 years long, with the study design of a step wedge cluster randomized trial. So it's more robust trial. As you can see the star marks in the map on your right, we target 4 districts under the same referral system of hierarchy of health facilities in Uganda. And this time, we successfully engaged mixed type of facilities, whether it's private or public, or whether it's a hospital or smaller health center. Currently, we are in the baseline phase of the study and expect to start the intervention, which is the WHO multimodal strategy of hand hygiene, starting in November. Uganda is also struggling with COVID-19 and was locked down until recently. But the research assistants, my friends, just restarted their baseline phase activities and visited the participating sites just recently. In summary, we all know that the system change is prerequisite for hand hygiene, and local ABHR production can dramatically improve this first step. Uganda is a unique place where ABHR is produced by a manufacturer with support in collaboration with other local private companies. Through Mikono project, we hope to show that the scale of ABHR production is potentially more sustainable and can create a win-win situation for the local people from employment standpoint, the healthcare workers from a user standpoint, and the patients from patient safety standpoint. Furthermore, COVID-19 created more opportunities for ABHR use in the community setting where the access to water and soap is still limited. Then the local ABHR production in a more sustainable way is a very important factor all over the world. This is the end of my talk, and I thank my collaborators here. Thank you for listening to my speech.
Thank you very much. Thank you very much, Hiroki, and thank you, Fernando. Thank you, Pierre. Well, what I want to do, if you agree, is I want to propose to actually quickly share one thing on my slide, and just to have I don't know if you see my slide on the screen. What was do you see my slide on the screen? Yeah. So yeah. If you review the title of the talk of the session today, hand hygiene challenge well, sorry, I just, can you hear me? Yeah, hand hygiene challenges in the community and healthcare settings during COVID-19, alcohol-based hand rub as a game changer. We had Pierre talking about the community and the healthcare settings, about the barrier and so on and so on. And then we had Fernando, and then speaking about the alcohol-based hand rub and the efficacy, and as well as the quality control, and then Hiroki about local production and implementation in Africa. So I would like to thank our sponsor Saraya to allow this fantastic tour of the world and to discuss this game changer that is actually hand hygiene, and in particular alcohol-based hand rub. So if you don't mind, now we will open to questions and answers. We have received several questions. We'll see how to handle that. One of the questions is, in reality, what is the possibility of getting infected by SARS-CoV-2 from your hands, bearing in mind that the predominant mode of transmission is airborne? So maybe Fernando, if you want to start, and then maybe Pierre give comments, and let's all discuss it. Fernando.
Okay. Well, thank you, Dion, for the question. But I respectfully disagree with you that the airborne transmission is the main route for this viral transmission. It's a matter of a huge debate in the scientific literature. It has been demonstrated in some occasions when a super spreader event occurs in a very confined place with crowded people. But we all agree, we do believe that droplet transmission and contact transmission are the main routes for this virus spread. So, so bearing this in mind, hand hygiene is essential to cut the chain of transmission. Of course, it's not enough. We should comply also with face masking and this social distancing, as I mentioned before. But hand hygiene is essential not only to stop the spread of this virus, but also to other respiratory virus and other enteric virus. So I respectfully disagree with you. Would like to know what the other panelists think about.
Pierre?
Oh, we also have this question and this debate in France. I think nobody exactly knows the proportion of the transmission routes, and it's not a unique setup. It depends on the viral load of the patients, on the contact time between the professional of the patient, the type of care, and many things. And I think it's maybe not the perfect idea to create an opposition between transmission modes, because if you focus only on air or droplet transmission, you will focus on the masks nearly only, or air treatment, and all the transmission will come from the other mode of transmission, the hands. You will manipulate your protector respiratory mask without hand cleaning, and you contaminate yourself, you would touch your eyes and things like that. So I think we should address all the possibilities of the transmission of the virus. And if we are able to do that, we will control, at least the most we can do, the virus transmission. It's my vision of the prevention around COVID.
Yeah, obviously, I don't know, Hiroki, any comment? You have been working hard in Japan. You have been in the famous boat that was not popular, but known all around the world for the problem of COVID transmission. Any comment on your side, Hiroki?
Well, I don't know the exact answer as other panels said, but actually we conducted a study in the Diamond Princess cruise where we sampled lots of surface from different environment stuff, and then we essentially identified SARS-CoV to everywhere in the occupant room, meaning there is always possibility of a respiratory droplet transmission and the airborne transmission, but at the same time we can't completely ignore or exclude the possibility of a transmission caused by hands. So yeah, so as Pierre mentioned, I think it's important for us to cover all possible source or ways or method, the means of transmission. So
yeah,
it's over.
Definitively. Thank you very much. It's clear that our hands are moving everywhere, and that's the issue of our hands. We have wonderful hands, but the problem is we are moving our hands, and within the environment, as you say, we have seen recent papers that really showed how much the environment could be completely loaded with COVID, and I think it's important. And from there, probably understanding the behavior. Pierre, what is the sort of based on the many studies you showed us? I mean, what would be for you the best way to promote good hand hygiene behavior in the community? We know we don't have the 5 moments in the community. We don't know exactly what is the background of the community, but you have been studying those barriers at a very important time in this COVID pandemic. So what would be your best way, according to your feeling or your research, to promote hand hygiene in the community?
To my opinion, it could be quite simple. We need to maintain the awareness. So we need to have handrub product dispensers nearly everywhere. In public situation, you need to have it at the entrance of any store. You need to have it and have full one in the public transportation. Not everyone will use them, but we see that if you have it, it's a product is of good quality. It's another very important thing. We have seen the barrier that's a bad product is really a huge barrier. So we need good products, and during the crisis, we have seen that before we have nearly only good products, and that we had a lot of different products produced by non-specialists of the products, and it was not easy to use. So you need to have good products, you need to have dispenser everywhere, you need to make them identifiable. And after that, in France at least, if you want them to be used, you need someone to remind you that it's important to use it, and not on an aggressive way. Just the people were just saying, please disinfect your hands, and 9% on 10 will do that. One will just yell, oh yeah, I'm an allergy guy. Well, most of the time these are men, and but it's not the problem, 1 in 10. So it's quite simple. Create awareness, make it easy to do that. If I'm close to a dispenser in the subway and the product is a good one, I will use it.
Yeah.
If there's nothing, I will not do that at any way. So to my opinion, say make it easy, and as we proposed, create a surveillance network to assess and to give feedback to the population. Just we are at this point, that's it. So you can improve if you want to, but just think at the situation.
What would be your feeling, Fernando, in Brazil? Would it be the same? I mean, Pierre is telling us, make system change a reality in the community and then monitor and tell us where we are. So what is your feeling in Brazil?
Well, I totally agree with Pierre. Well, we should not lose the momentum. This is a kind of a positive side effect of the pandemic, that the hand hygiene awareness outside the healthcare setting has been expanded. And we should keep in mind that hand hygiene is an essential hygiene measure. It's not only designed to prevent COVID-19. It's designed to prevent many infections and many health problems. So I believe that we should have this availability wide open, as Pierre mentioned, but we should keep talking to the general public. What are the benefits of performing hand hygiene in your daily life? This is very key to sustain the compliance with it.
Thank you, Fernando. And now I would like to go ahead with this tour du monde, because remember, Fernando is in the morning in Brazil and Hiroki is late at night in Japan. So how will it be in Japan? Do you see this system change coming in the community, Hiroki, in Japan currently?
Well, I'm pretty sure lots of alcohol-based handrub is available in the communities, but I'm not sure if people are actually continuing to use them properly. So I haven't seen such a study yet in Japan overall. So I'm looking forward to such results, but but I haven't observed personally yet.
So it means that we are still a way to go if we want to promote this hand hygiene. And remember, the environment is contaminated, so Clean Hospitals has a sense in promoting this. We have more questions, but only 2 minutes left. So in one short sentence to link Hiroki to Fernando, Hiroki, how could you imagine to do quality control when you do local production in Africa, for example, or elsewhere in the world, to make sure you meet with Fernando's requirement of quality control? So Hiroki?
Yep.
Yeah. Did you hear my question? So how do you imagine to do quality control in when you do local production in Africa, as recommended by Fernando?
Well, well, it's a great question, but we definitely, have to work with other people, other expertise like Didier here, and then we definitely need like a global, network. Even though we are in a difficult situation right now, still we are all connected like this. So definitely we need to, keep updating everybody in the world, even if the resources are limited, still we can approach and reach them, make sure they have a proper high quality of alcohol-based handrub.
Very good. I'm sorry, I guess we need to close. We could continue to discuss this fascinating topic of hand hygiene worldwide, and thank you again to our sponsor Saraya for this unique session. At least Pierre and myself need to move to the third session of this actually Clean Hospitals Digital Day. I'm pretty sure many of you will join, but thank you very much. It was a fascinating session, and looking forward to see you on the second Digital Days on the 7th of December. Bye-bye, everyone, and thank you very much. Bye-bye.
Bye.
Bye. Bye.